Power Living with Kimberly Langford, where inspiration meets empowerment. Kimberly is a nurse executive, leadership coach, Reiki master, and your guide on this journey to whole person wellness.
Hey, 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 here we are. I am so super stoked to get some time to visit with you, Mendel, and here on the podcast. Mendel is the CEO and founder of CareCo, CareCo, which is an AI co-pilot and really built to amplify care coordinators, not to replace those folks. And I think the prowess of your tool is to provide that automated documentation platform, tightening quality and compliance, and really embedding AI into that full the workflow for the clinician. But welcome, and gosh, if you wouldn't mind, tell us a little bit about you and your journey. What made you dip your toe into AI?
Well, thank you so much. And firstly, it's an honor to be here. Excited to be a part of the show. So thank you for the invite. I've been in the care coordination space for about 8 years, actually. So I built a service-based company that I still have called Previva Health Group, and that is a company that does care coordination on behalf of typically primary care physicians. We currently talked about 6,000 patients a month, and doing programs like chronic care management, remote patient monitoring, annual wellness visit support, transitional care management, kind of ongoing preventive care. And so building that company for 7, 8 years and building it step by step really gave me a deep understanding of not just the behaviors that make care coordination work as a process and as a program, but I think more importantly, the behaviors of the folks that actually do it. And that's been really critical to not just the genesis of the idea of CareCo, which I'll talk about, but the way, I think more importantly, the way we're going about it and the way that we're building. And so about 2 years ago, so it was February of 23, I guess, well, that's when the initial idea came into my head. This idea popped in my head of like, I can build something that is hyper specific, hyper, tailored for care managers, care coordinators, care teams. And it's this interesting kind of part of healthcare, right? Because you've got most folks are going after the doctors. They want the lion's share of healthcare. That's where the doctors are. And you've got all the tools and ambient recorders and note takers and all this kind of stuff. They're going after all the doctors. Then you have other folks that are focusing on the patient. And there's this kind of not very recognized, not very overly paid attention to slice of healthcare called kind of care teams, or the folks that sit between the doctor and the patient. And those are the folks that are doing, like I said, transitional care management, ongoing care management, utilization management,
Yeah.
various different forms of care coordination. And those folks really are the foundation of their patient's entire experience with healthcare. You know, as
Yeah.
someone that's done this service for the last 7 years, you learn this very quickly. Patients have a doctor. They see that doctor for, I don't
Five
know.
minutes.
Yeah, if they're lucky, 5 minutes. It's a whirlwind. Even at
Yeah,
their annual, they'll go home, pick up the phone, and call their care coordinator and say, "Hey, can you do me a favor? Can you look at that visit note and tell me what the hell just happened? Because I have no idea." Right.
absolutely.
And
Yep.
so, when done correctly, care coordination really becomes more than just a program, but it becomes really critical for the entire experience. And when you talk about trying to reduce utilization, it all comes down to a relationship. I mean, think about it. If you have a friend who's, what do you do when God forbid you've got a, I don't know, health question? What do you do?
Right. Well,
What do you do?
yeah. So if I don't know it, I ask a trusted colleague. But you're
Exactly.
absolutely right. That's what people are going to
Exactly.
go to. Well, if they don't have a nurse in their pocket or a doctor friend, they're going to ask their neighbor across the fence.
Right. Or they'll just go to the ER because you don't.
Google.
Right. Or they'll just Google, which means everyone has cancer all the time, and then they'll go to the ER, right?
Yeah.
So that's not good. But if you're not one of the probably very few that are lucky enough to have a close friend who's a doctor, that's what you're going to do more often than not. So having that
Yep.
relationship with a care manager is really, really critical. And I don't think it's being done well. And I think the proof of that is how little it's funded comparative to kind of some other programs. And so all that kind of came together to, hey, we can build something that is an AI co-pilot for care managers, care coordinators, and really the entire care team something that understands that technology is better inherently at the brain of care, but humans are better at the heart of care. And that's never going to change because there's something superhuman. And this is something that so many people in technology get wrong. You've got all these tech companies that are building these AI bots and agents and all this stuff. When it comes to care coordination, you are calling patients that don't know how they're putting food on the table next week. They're not thinking about the gym. They're not thinking about their exercise routine or their diet or how exactly to get healthier food. That's who
Right.
you not only have to get in touch with, but you have to change their life. You have to change their behaviors. So the level of humanity and the level of relationship that needs to be built to create that effect is so deep, that yes, there's place for, AI if you're trying to schedule appointments or if you're just, lonely and want to chat at somebody, which is a whole different thing. Sure, there's a lot of different areas for agentic AI, but when it comes to changing that, diabetic's life or that patient with stage 4 chronic kidney disease or whatever, that's really really human. And so we wanted to build something that understood that dynamic between the brain and the heart, and our kind of mission has been boiled down to this line that we want to build the brain to amplify the heart. So we want to build the perfect brain of the perfect care manager that remembers everything, always has access to the right thing to say, always can do all the annoying parts like generating documentation like you had mentioned, task creation, management, communications, but then leave the heart, leave that impact to the human.
Nice. Well, and two, when I think about, the real power of AI, being able to harness, to your point, some of those other tasks that, maybe we don't need the nurse to do or the navigator to do. And that frees up bandwidth and time for the human, if you will, to do that work that the human excels at. And especially in an environment where, when you talk about doing more, you have to be efficient and productive in order to serve, your clients in the right way. Um, Interesting though, I think a lot of my colleagues and clinicians, when they think about, harnessing an AI tool or something like that, I think sometimes we tend to maybe merge. Either we think it is going to drive the whole thing and make a lot of errors, or we think that, it's just a transcription kind of tool. And I think sometimes we lose the value of the real work that, an AI platform like that does. How would you describe the difference between, I know you said before that AI Scribe isn't the product, it's a feature. So tell us a little bit about what the product is, while AI is the feature in the product. Um, Tell me a little bit about that product and what makes it different in the marketplace where other scribe tools really miss the mark.
Yeah, so there's a couple questions there. I'll say a couple points. Firstly, this is where it really is impactful to build something that is purpose built for a particular use case and not try to go after 10,000 different buyer personas, right? Uh, the magic is in the understanding of the workflow. That's where the magic is. Because if you don't get a workflow tool right, it will not be used. Right. And so you're
Right.
seeing this in the kind of race to the death of all the big, note taker companies, that they found out very quickly that this technology is extremely easy now and there is no moat in that tech. And so they're all raising a ton of
Yep.
money to expand out to take on, RCM or whatever the different areas that they're going in, because they're understanding they have to be workflow tools that extend to other parts of the workflow. They can't just be a note taker. And so that was very
And
apparent to me from day one. And again, because I've been building the service human side for 8 years, it was extremely easy on how to build this very, very particularly for the care managers. So that's point number one. I think the secret is really in it's really in the workflow. It's understanding that end to end and building something that is purpose built for the people that are there to use it. Um, and so, yeah, I think a lot of folks get that part wrong, because when you're it's also the type of company that you're trying to build. If you're going to build a company and you're going out to raise and you're trying to do all this, like you have to show that you're going after this multi-billion-dollar market. And it's difficult. It's difficult to convince people that I'm building something for a specific subset of people because you feels like you have to take over the whole market. Otherwise, you're not going to be this multi-billion-dollar company. And I think the incentives are off there, you know?
Yeah, absolutely. Well, if you're everything to everybody, then you're nothing to nobody.
Exactly.
So,
Amen. Yeah.
yeah, absolutely. I love that. And you had me with workflow because I think workflow is so important, especially in healthcare, where I've never seen a period like this in my entire career where, a lot of the old guys, they've left. They're not here anymore and they're not coming back. And a lot of our experienced folks, they're not there. And so to be able to have a tool where you can help new team members become successful and competent quickly and not have gaps, or to your point, where you're really able to do more with that embedded tool. I mean, a lot of teams, they'll get 20 to 30 calls in an afternoon, or, and you think you're finishing your note because you're so busy typing all the things and checking all the boxes, and the phone rings and you got to pin this one. Heaven forbid if you don't go back and finish your note, right? It's
Yep.
that workflow is a real problem, and it does lead to gaps. It leads to missed opportunities.
Yep.
And so I think that's a real differentiator.
Yeah.
Um,
And yeah, it's really important.
Now I have a kind of a side question.
Sure.
So are you saying then if you have a company that specializes a certain niche, maybe you specialize in MSK, for instance, or maybe your specialty is cardiac or oncology, can you integrate that tool then and customize it with those particular care flows and pathways?
So I think the approach is, I talk about this sometimes when I go out and speak at these different things. No one uses AI. Nobody. You don't use AI to use AI. You are trying to get something done. That's what you're trying to do. And everything from a technology perspective that you are actually going to use and enjoy using, not because you were mandated to use something, is going to come about because those things are in service of you trying to get that thing done, right?
Yep.
And so it's not even specialty. It's understanding the human. What is the outcome? What is the outcome that you are trying to
Mm.
accomplish? At the patient level, what are you trying to enable your user to accomplish? But at the user level, who is that person and what are you trying to allow them to accomplish? And that's why it's not just specialty specific, but understanding the actual person, even within a specialty. Who is the person? What is their workflow? What is the program that they run? You need to have a nitty-gritty real, understanding of the minutia around what are they doing. We sit and I feel so incredibly blessed to have this experience and to have that first company because we're able to sit with them and see how they're navigating
Mm.
around 6 different tabs and how they choose to pop around the EHR and when they choose to pull up the chart before they call the patient. And, like all these little tiny little things really make an impact in the way that you build technology. And so yeah, I mean, once you nail the workflow for the person, I think it matters less the way that we've built CareCo. CareCo is actually extremely adaptable to various different
Mm.
like the specialty doesn't matter. The care that you're providing does not matter. We've got therapists on CareCo. We've got home health. We've got chronic care management, remote patient monitoring. Um, We've got pharmacists on there. Like you name it, that's why we call it care teams, because it's basically all these folks that just sit between. But you know what they do have in common? All of them are doing the following thing: pre-call or pre-conversation prep,
Yeah.
post-call documentation, post-call follow-up action items, and post-call communications to either pharmacies, providers, referrals, or patient. Those steps are being taken by every single person.
Across the board. Yep.
Then the individual pieces of those change, right? So this one wants this particular type of documentation. This one wants this particular type of task. This one wants this, and that's where you build in that kind of flexibility into the platform. But it
Mm.
really just comes down to understanding your user.
So, I love what I'm hearing, Mendel, because I have found in the systems that I've used, they've been the most helpful to me when I did have somebody looking over my shoulder and seeing what I was doing. So I'm just curious because I've heard you speak in different forums, and the passion is so front and center. Where does that come from?
Where does the passion come from? Extreme ADD mixed with no, I don't know. Look, I mean, we've got 25 employees at my first company, and now I'm blessed to have, we're close to 500 users on CareCo now. And when I get on these onboardings, and so what we do is, when someone comes on, what I like to do is instead of me doing a demo, most people, the person from the company shares their screen and they say, I don't do that. What I do is I have the user who's seeing my platform for the first time ever. I send them a welcome email. I have them log in and I have them do the demo in front of everyone because that's how easy we've made the platform. And when you watch the face of these users who have been spending the last decade or 2 decades doing care management and care coordination, and they know the pain, they know the work that they've been doing up until this moment, and you watch them just understand like, oh my gosh, like that aha moment when they complete their call and they see everything kind of populate for them, and then they see the call guide for that next conversation and it tells them exactly what to follow up on, talking about my niece and talking to, like when they see that, I've literally had people in tears on these calls.
I
And
can imagine because in most programs, it takes a while because you have to fit your process inside their tool.
yep.
And it sounds like what you've built is a tool that really fits inside a provider's process.
Yeah. And so,
That's
yeah, I
really
remember one
refreshing.
remember one person like literally in tears saying like, "Where has this been for the last 10 years of my life?" Like almost like looking back at her life and being like, "I've wasted so much time." And I think this, you know what? I think this is something that this age that we live in right now with technology is going to do for us, where we're going to look back at the time that we've spent, you know, doing things that were a literal waste of our life. You,
Mm.
you you
Oh,
talk
yeah.
about you talk about earlier. I mean, can you imagine going and plowing a field now, spending 40 years plowing a field when now you can just go to the supermarket and buy flour, right? Like if I took you back to that, you'd be like, "Well, thank God I don't live in that era because this is way easier." And you talked earlier about, the people being burnt out and how you don't like that word. People aren't lazy. We just don't like doing things that we don't like doing. Like it's that simple.
Or that have
Um,
low value.
Yes. Well, that's usually why we don't like doing
Yep.
things because of one of two reasons. Either we're not good at them or they have low value,
Yep.
right? Like that's why. And so 90% of the time that is being spent in healthcare is typically forcing someone that went to school to care for patients to do one of those two things. A low value to them or to the patient, it's probably valuable to billing and to the business side, but not to the care, not for the thing that they went to school for. So it's low
Yep.
value to the care, and it's usually something they're not good at, like navigating a bunch of tech, right?
Yep.
So yeah, when you watch these people see like, oh my gosh, we're at this place in technology where something actually understands my workflow, and I don't have to do all the things I've been doing for the last 10 years that have just you know wasted my life. They get emotional, and it's just very touching.
I just had a picture flash in my mind of the old days we used to have to handwrite in a paper chart a head to toe physical assessment. I mean, it would take up a page. Do you imagine sitting at a nurse's station 30, 40 minutes writing oh my gosh, it's
Yeah,
crazy.
yeah.
Well, let's talk, kind of switching gears a little bit. I was really interested, where you and I have talked before, where I can also see this tool being really helpful in terms of helping an organization improve in terms of quality and compliance. Can you talk a little bit about how does the tool support those kinds of measures, um, like scoring, audits, that kind of thing? How can the tool help an organization sharpen the saw, so to speak?
So we'll do a little breaking news on your show here. I literally finally got my hands on this feature set that we've been building for last year this morning. started messing around with it.
Oh, it's
So
hot off the
yes,
press.
this is hot off the press. Just for your listeners here, let me take a step back and just describe briefly what CareCo does if it's not clear. CareCo is an end-to-end co-pilot platform for care teams. It's a communication platform, firstly. So we built a phone system, a video system, texting, and an in-person ambient recorder directly into the platform, which means that all of your patient communications, no matter how you're communicating with the patient, goes through CareCo. Now, that's really important because CareCo is this brain that's kind of building a mini AI brain on every individual patient, remembering everything that was ever said to that patient, whether that was a phone call, a voicemail, a text message, a video call, or in person. And then it does two things. The most important thing is it gives you a guide for every single conversation that without doing any prep will give you this like hyper specific, hyper personalized talking
Mm.
points and discussion items, both from rapport building and clinical to guide the patient to the clinical outcome of the call. And then when you get out of your conversation, you're going to get your documentation, your tasks, and your communications, or anything you need basically that would take up your time to do manually is done for you. That's in short. And so the flagship feature is that call guide, and that I think is the future of care. And so up until
Hmm.
this point, it's been really cool. It's kind of been a hyper personalized, script, but really hyper personalized, that remembers, but it kind of learns from all the previous interactions to understand where to go. What we've built, and this has always been the vision, but what we finally have is the ability for you to come in as an organization and set up various different kind of profiles of call guides, or maybe you can call them like a care program. So you come in and you say, okay, at my company, at my healthcare organization, we do X. We do transitional care management. We do a diabetes education program. We do nutrition, whatever it is. You can then create these mini profiles where you describe what the perfect ideal conversation should look like at a high level. And so, but at an intelligent level. So it can be the various different compliance things like has to be HIPAA compliant. We need to tell them that they're on a recorded line, like some of those things. And then we always need to be addressing the chronic conditions that are on the care plan, and also we should be doing motivational interviewing, and also I want to know that every single time a patient brings up any kind of concern, it is at least addressed, meaning like they say I will do XYZ with a clear action item, even if you're not the person to
Yeah.
fix it, but you're addressing it, right? All these intelligent things. Summary at the end of the call, repeat back to the patient what you're going to do for them. Anything that you can think of. So you build this thing. CareCo then takes that profile and then you assign it at different levels, stacks that kind of stencil, let's call it, on
Hmm.
top
Yep.
of all the
A
contextual
framework.
data for the patient. And to create this hyper personalized version. So now when it says to discuss, rapport building with Kimberly, it's, hey, how was your niece's ex, and like when it's clinical. Oh, last time we left off, you were saying how you couldn't find that orange medication bottle. You weren't sure what it was. Have you been able to find it? Can you read the label for me? Like all of that is where it becomes hyper personalized. But here's the kicker: every single call can now be scored and reported on at the conversation level in CareCo. And so every conversation that follows those guidelines will now have an intelligent analysis with a score that will break down every single section that you've determined is critical to the success of this. By the way, care gaps identified, care gaps closed, reduction utilization, you name it, is now reported to you with an intelligent reason why it was reported as such, citation to the point of conversation where that thing happened.
That's huge.
Yeah.
Huge. And I love you. So you mentioned rapport building several times. And that's so key because you can't change behavior unless, people feel like you care about them. It's impossible. And without a trusted therapeutic and professional helping relationship, you're not going to really impact somebody's life for good.
Yep.
That's awesome. And then I think of all the HEDIS, all the different kinds of things that we have to capture and report on. I mean, there's been some initiatives where for quality and improvement measures where, folks have abandoned them just because nobody could keep up with all of them, or
Yeah.
things were too expensive and too cumbersome to put into place. Never mind that they may or may not have had value you just couldn't even try it because
Yep.
it wouldn't fit. So
And an additional point that's becoming really, really interesting, and the current CMMI. I don't know if you know if you see Abe Sutton around. He's just every week he's dropping another model. It's crazy. Today he dropped another one that's going to replace the ACO Reach program called LEAD, and he's constantly dropping these models. And one of the most exciting ones he's dropped is a model called Access. And the common thread between all these models, and even before this administration, even with the previous administration and the leadership at CMMI, we're moving more and more towards aligning the incentives with value-based care and doing a lot
yep,
of show me, don't tell me, right? Like outcome,
mostly.
outcome, outcome. Now,
Yep.
that's really good because it'll start aligning the behaviors and the programs in that direction. But as we start to succeed, we've never had these problems because we've never succeeded at value-based care. But as we start to succeed with value-based care, the biggest issue is going to become proof. If
Yep.
you are doing a program with the patient and I am doing a program with the patient, and then both of us and then we succeed. How do we know that? Because the patients, they have a reduction in utilization. They're not, they're not going to the ER. They're whatever it is. Who should get paid? You or me? Right? All we
Oh,
know is
that's true. Because a
all we
lot of
know
these
is
patients, they're seeing a cardiologist and they're seeing an endocrinologist and they're utilizing a nurse coach or, yeah, absolutely.
right?
Ah,
So,
very
so no
interesting.
one, no one's thinking about this yet, but this is where the puck is going, right? Right now, it's not an issue because you
Yeah.
do your fee for service, I do my fee for service. You're in your zone, I'm in my zone.
Scrap it out.
Once,
Yep.
but once we're like, no, no, there's going to be dollars going to a better outcome on this patient. Now you have 10 people that are claiming it was me, it was me, it was me, it was me. Who is it? And so it's going to take a care code to say, oh, here is the exact intervention that I took that now I can report at scale to prove the value that I'm providing the patient.
Oh, and I think payers are hungry for that. A lot of these great programs that, folks have in place, us here at Boone Chapman as well, it really comes down to that, right? Because the payer, the employer sponsored health plan pays that service and they get the invoice for it. And you can see where you had an impact in steerage or there's a hard savings, but some of those other very robust and longer term game changing savings in terms of truly altering the trajectory of a health plan and the health of its members, those are harder to track
Yep.
and harder to prove. And I think a lot of them, they want those kind of programs, but it's really hard to flesh them out, to your point, because a lot of times people they can't prove them. I once saw a company, they just blanketed every intervention they had was worth X dollar amount. Didn't matter what the intervention was. Well, that's doesn't work like that.
Yep.
So I think that's really, really amazing. So, I mean, it sounds like you've got some pretty impressive validated, not to overuse the word outcomes, but for your platform where you're really able to streamline and make the clinician's workflow more efficient and productive, and scale the capacity for improved outcomes and better utilization, more robust and well-rounded, holistic, if you will, utilization of their healthcare experience. But what kind of numbers do you have out there for the marketplace? What can people expect when they take a peek under the hood at possibly, entertaining, integrating CareCo in their workflows?
Yeah. So just some context on where we are because it's easy to have outcomes at a small scale, but as you kind of move up. So we launched formally in January. We have, I believe we're closing in on about 100,000 patients now. Last month, we did about 60,000 patient conversations analyzed and supported in the month. And when I say patients, I mean actual actives being spoken with patients on the platform. I don't mean any of these fluff numbers of like patients loaded into the system or anything like that. I'm talking about communicated with in a given month.
Real
So
work.
real work. And so that's exciting. And yeah, look, I mean, immediately you're going to see a 40% increase in productivity and efficiency. I think but that's not interesting to me really, because that's just getting started really. There's so much to cut away. If you just think logically, I'm saving you all this time pre conversation, and then I'm saving you all this time post
Yeah.
and task creation, management, communication, creation, and documentation. So I think that's just getting started. I think the industry, I think we know what the continued work that we have to do in order to continue to strip away a lot of these barriers to communicating with the patients and having more impact with the patients. Um, and um, and I think the most interesting part is going to start on the value side. I mean, there's
Yeah,
some small value things that we're seeing already. I mean, the conversations are obviously longer with the patient because they have more things to talk about. From a staffing perspective, obviously burnout, quote unquote, is down to really, really minimal. And so, yeah, that's what we're seeing so
well,
far. But I think
well,
we're
I
just getting
think
started on the numbers.
well, it's interesting because I think too there's some real ROI there. Maybe it doesn't jump out at you, but I think about, when you talk about increasing the productivity of a clinician by 40 or 50%, what if you could see 40 or 50% more patients? What does
Okay.
that do? What does that do to your
Okay. So
practice?
I have an idea that I've been toying with, okay, that I'd love to hear your thoughts on. Um, it's a little commie vibe, so a little socialist vibe. So I'm not 100% sure about it, okay? But the idea is all these efficiency gains are great. And if we're trying to reduce burnout, that's great. But how much work is happening right now outside of the 8 hours, the supportive work, the pajama, that whatever these people want
Absolutely.
to.
Yep.
And so what happens when AI is just used to just shove another 400 patients down your throat? And now yes, you're doing work that you prefer doing, but you're just still completely overburdened, right? And I think there's an interesting opportunity here to flip the script and say, you know what? I know what ROI I need from an employee in order to have a feasible,
Mhm.
successful business. And that's the cap that I'm going to put on. I'm
Yep.
going to give you all these AI tools to allow you to kind of unleash yourself and just get things done in a much more efficient manner. And I'm not going to increase your caseload. Wouldn't that
Well,
be something?
it's interesting though when you think about that. I mean, I've worked in organizations where sometimes you're spending 30 minutes reviewing a chart just to figure out what you got to pick up the phone and talk to the member about. It's ridiculous. I could serve somebody in that time. Or to your point, there's a lot of companies out there that are doing the work, but they don't have time to do. So we have revenue generating activities, which is like seeing the people, talking to the people. And then you have activities that support that revenue. So when you think about that, how many organizations would love to do an audit but can't because they're caught on that hamster wheel? So to your point, increasing that, you could certainly see more patients, but there's a certain value or an ROI in being able to do the supportive, the revenue supporting activities, if you will, to make sure that your organization is producing. I mean, because it's a pretty competitive marketplace. What is it that's going to differentiate company A from company B?
Yeah.
And when you
And
have an organization that's not only providing compassionate and personalized care, which often, when you look at other, scribing tools or platforms and it's just really generic, there's a real value to picking up and, to your point, how is your daughter doing? Or how was your son's first day
yeah.
at college? That's huge.
Yeah. And
And
and let me put some numbers on this just to give you some perspective. So pre-CareCo folks are doing between 150 to 250, depending on the type of program, patients on a caseload per month. Okay, that's how many a typical care member's able to see. Post-CareCo, 350 is basically a piece of cake. And where
Mhm.
I'm going with this is what I'd like to accomplish is I've done the math. And you can, technically speaking, care for 350 patients working 6 hours a day instead of eight. Okay. And so I've picked up your caseload by 100 patients, but I can show you how you can actually get that done now in 6 hours instead of eight, or maybe working 4 days a week instead of five. And I'm toying with this idea of saying, you know what? I'm not going to then say, oh, well, then let me just backfill those other 2 hours with whatever the math on the patients is. Let me bring that up to 400 patients. I'd like to say, you know what? No, like let's all win by using AI. I'm winning because as the company, I'm now bringing in more revenue with less overhead, right? But let me put a cap on it. Like I'm doing good here. You should also get, as the employee, you should get the benefit of using AI, that it should make your life easier. And if you want to work 4 days a week instead of five, but you're creating the same output for your job, then great, go do that. You do you.
Interesting concept. I don't know if it was my company, I'd be for more revenue. That being said, there's, clinicians. So, a concept that's really important to me is creating organizations and teams where clinicians can practice to the top of their licensure and find joy in the work. There
Yep.
is no joy when you're duplicating, triplicating, quadruplicating, if that's a word, the work. I mean, I've seen people copy and paste segments into four different platforms. Shut up.
Yeah.
Or, you're doing the same work three or four times. Twice. I don't like double charting. It's mundane and it robs the joy of the work, not to mention the productivity. And I think, too, one of the reasons why you may be seeing that jump is because the workload is probably more enjoyable.
Yes.
I mean, and what are people going to do? I mean, yeah, maybe extra vacation days. It's an interesting concept. I'd be interested to see, I don't know. I think when you take the girdle off, so to speak, and you let people bring their magnificence to the workforce, and I just think you for the right people, at the right times in their lives, it's really amazing what a team can produce. That being said, I mean, working a 6 hour day for clinicians, a lot of times it's not an 8 hour day. Tell me a nurse that has a an 8 hour day anymore. I can't think of any.
Right. But that's my point. What if that's why I think everyone wins? Because if I can take you from a 12-hour day to a 6-hour day, and I can take you from a company perspective from 250 patients to 350 patients, if I can square that circle,
Yeah.
now we don't have to pull everyone to their extreme. We don't have to like, I don't
Yeah.
know. Again, I'm still toying with it because you're right. It is not the capitalistic thing to do. It's like, if you're the company and you have to, whatever, especially if you have shareholders and things like that, you can make the argument that just go for the maximum amount of money. But I think there's something nice in this, their kind of Elon Musk vision of how AI is going to like impact all of us. And he's been on this rant about how, money is
Yep.
going to be a thing of the past and all
It'll
that
be
kind of stuff.
optional. Yeah.
Yeah, just like this like messianic era type thing. But I think that with the right people, some of those gains can be realized in the short term. I mean, to me, that sounds like a dream. If I can
Yeah.
tell you I'm going to increase your revenue by um, some insane amount, by the way, because it's without any increase in overhead. So any increase is pure net, right? So it's an
Yeah.
insane increase. If I could take you from the numbers are 250 to 350, but with the same amount of people, the net revenue increase is insane. So if I can do that for you and at the same time tell your employees they can now work for 6 hours a day or 4 days a week, and the patients get better care, more personalized care, quicker care, everybody is winning because of Gen AI.
Absolutely. Absolutely. Very, very interesting. Gosh, I had a thought. It'll come to me. Um, oh, it was pregnant with possibility. It'll come. It'll come. Um, so what are some things that, like, when you're sitting down with a potential client, somebody that you think would really benefit from your platform, what are some questions that you wish they would ask you?
Hmm, that's a great question. What are some questions I wish they would ask? Honestly, how can this impact, how is this going to impact my bottom line? It sounds like you would expect people to ask that, but they don't. And they're busy
Really?
trying to find budgets for like AI tools. And I feel like we're in this really easy kind of conversation because it's like, here are all these things that are costing you money and we can just kind of manage. But it's difficult to get into that conversation with folks sometimes. But
Mhm.
yeah, I mean, most folks that are most of our clients, by the time they're coming to us, they've seen a lot of the content and they kind of understand the product, so they're coming with an understanding already of what it does and where it fits in the
Yeah,
organization.
because you share a lot on your website,
I
by the
try.
way.
Yeah, I try.
Yeah.
Yeah, it's a decision. Even you'll see, the way I'm talking in this conversation, it's a decision to be very transparent and to just communicate what you do. I think there's a lot of people out there that think that, don't share, either because of fear of
Yeah.
competition. You don't want people to know what you're doing, or um, it's actually quite a difficult task to communicate effectively what you do. It's actually quite difficult.
If you
And
do
so
it well, it's difficult.
yeah. So either they don't know how or they're scared to. And so, or they think, or I think the stupidest version of this is like, oh, the mystique will make people book demos because we'll show them just enough to not understand what we do. And then they're
Oh,
going to
but
book a
it's so
demo.
annoying.
And that doesn't happen. If I'm giving you four milliseconds to decide if this is interesting to me or not, I need to understand exactly what you do. And if I don't, I am not booking a demo because I don't know what you do. So.
Yeah. Oh my gosh. We can share some stories around that. Oh, you
Yeah.
got to tell me your workflow first. Why do I want to tell you my workflow? If I don't know you're going to be a good fit, just show it to me. Let me look. Let me drive the car before I
Right.
decide if I want to go on.
Oh,
Yeah.
but if you give me your email and your social, then I'll send you a 10 page thing on how to get into my webinar that'll teach you how it's like, just show me what you're doing.
You know, the other thing that comes to mind is, we are in an era where we're going to see such a huge uptick in healthcare and the utilizers of healthcare. We're seeing that already. And that's also cool. It's at the same time that we're seeing a decrease in providers. And I mean, we've always had a shortage, but this is like, oh man, I could tell you some stories. There's some offices in the country where it's a physician holding down the fort and he's the medical records and the receptionist and the nurse and the doctor and everything
Yep.
because there's nobody there. It's crazy to me. And
Yep.
so, I really think that what you've built, Mendel, is absolutely something that is worth looking at. So,
Well, thank you.
let me ask you this because I know we've chatted for a while, but let me hit you with some hard and fast, quick questions.
Sure.
What do you think, in your opinion, from your experience in working with these various companies, what's one metric that every healthcare team should be tracking? What kind of numbers should they be tracking like on a weekly basis?
A new metric that we came up with called value to patient. And it's an intelligent metric that we're watching every single conversation saying, hey, CareCo, if you are the patient in this conversation, did you receive value? And the reason why I love that is because that is the bottom line. Everything else, that every other metric is trying to determine value. It's like trying to quantify a way to get to that real metric. What you actually want is, I have patients. Are they receiving value from these interactions or from this program at every single point? I think it's like,
Interesting. I
yeah.
like that. What about if there was one workflow that you could kill tomorrow? What do you think it would be?
There's so many. One workflow, if I can kill tomorrow, what would it be? The barriers that HIPAA introduces to patient communication.
Does HIPAA introduce those barriers, or do people who don't understand HIPAA introduce those barriers?
Good argument.
Oh,
Possible.
wait, can we say 6 or 7?
Let me find a 2-year-old. 1 second.
Yeah. Yeah. Oh, it was big in my house
Yeah.
this last week with all the grandkids over. Oh my gosh. Yeah, interesting, because a lot of people don't understand that patients do have a right to their information and healthcare. Yeah. Anyway, that's a topic for pizza and root beer for sure.
Yes.
What about if you were talking with a healthcare provider who is just maybe a care navigator who's just fried, what would your best advice to them be?
Use CareCo. No, I'm joking.
Hey, hashtag use CareCo.
Right, exactly. I think I would remind them that they're blessed. This is what I talk to my team about a lot. There's 1.5 million different ways to make a living in this world. And to make a living by helping people
Mm,
in one of the most beautiful parts of healthcare, because care coordination is all about that. There are some really dark parts of healthcare that are really traumatic and difficult to be in. Care coordination is not one of those. Care coordination is nice. It's great. You're fielding call, you're affecting patients, you're calling them proactively, so you're not, God forbid, coding patients in the ER. That's a blessing. And so I think the gratitude to that usually, should take away a lot of the angst. And then it's just a reminder that, hey, we live in this era now that we can work through the workflow constraints that are causing the burnout. But I think just that kind of zoom out is usually helpful.
yeah, the impact, or what did you call it? Patient value, the
Hmm.
metric. I think that's lovely. Well, if people want to know more about you, maybe they want to see it up close. Maybe they've been on, and if you haven't checked out uh Mendel's website, he's got a pretty good video there for you at careco.ai. But yeah, how do people, if people want to talk to you or they want to know maybe more in the weeds, or maybe there's some integration that they're looking at, how would they reach out to you?
So content wise, I'm one of those. I can't have any notifications left unread. So I'm pretty good at LinkedIn messages. But if you want to book a demo, just off the website, you'll see. I think what you're referring to. There's about a 10-minute video on the homepage that'll kind of walk through the gist of the platform. And then if that makes sense to you, go ahead and book a demo. And happy to show you around. We don't hold anything back, and I won't force you to jump through 100 hoops in order to see what we're doing.
I tell you, you're all about the mission, and your mission is all heart. And Mendel, I just really appreciate the great work that you do,
Thank you.
and how you're helping to bring care back into an industry that has become not caring. And yeah, thank you for all the good you do for so many people.
Well, thank you so much. Thank you for this wonderful chat, and yeah, this was fun.
Yeah, we'll have to do it again.
We shall. Episode 2 coming soon.
There you go.